and Dr. Paul Lichtenstein, who is also a board-certified dermatologist. Dr. Spark?
Nearly every one of us is a survivor of a dreaded and common disease. It's called acne, and maybe many of us can remember those humiliating and terrible days when we suffered with this disease. We're going to be talking about it with two dermatologists today, and this is Prescription for Health, and I'm Dr. Ron Spark. I'd like to first introduce Dr. David Jacoby. Dave.
Hi.
And Dr. Paul Lichtenstein. Welcome, Paul.
Thank you.
Let's first start out by actually seeing what acne looked like. I think you brought some slides. Let's take a look.
I did bring some slides of some rather typical acne patients. This is a young man that has facial acne. The next slide will show acne on the chest. We have another slide showing acne involving the shoulders of this particular patient. Other areas of involvement of acne are the face. Now this young lady has rather mild acne, but she's aggravated it by picking. And this is something that one has to be aware of. Picking does aggravate acne. The next slide shows another type of acne that it's not really recognized as being acne. This is called perioral dermatitis. It's treated very similarly to the way we treat acne and responds very nicely to therapy, most commonly seen in young women.
Well, we've seen what the acne looks like. Let's take a look at it under the microscope. I think that might explain what the disease is all about. You've brought a picture of a piece of skin, and explain to us exactly where things are and then what's going on.
Sure. Well, this is a representative section of skin. This is the surface of the skin. These are hair shafts actually penetrating the skin. And our main concern in acne is with the oil glands that cause the lubrication on the surface of the skin and, for the most part, are associated with the hair shafts, although they do open to the skin spontaneously as well. The problem is in the duct of the oil gland, which will get plugged and cause a backup of the oil, which will subsequently result in an acne lesion.
Okay. Now, there are some lay terms, Dr. Jacoby, that we talk about, and let's talk a little bit about those. I think the most common ones are whiteheads and blackheads.
Well, as Paul mentioned, Ron, when this becomes plugged, and we don't understand why this duct becomes plugged. This is one of the mysteries in acne, but it does become plugged here. If it's plugged just beneath the surface, we call this a whitehead, and it looks like a small, almost dot-sized white papule. When the plug gets big enough so it distends the mouth of the oil gland, we can actually see the plug, and it's usually black, and we call that a blackhead. I think it's important to point out here that the black is not dirt. For years, we've labored under the idea that we're not washing our face.
That's a good point.
Close enough or good enough, and we're getting dirt plugged there. But it's actually a mixture of oil and skin pigment that gives it that black color. And then finally, once this has been plugged for a while, sometimes bacteria get behind the plug and produce a lot of inflammation, which we call a pustule. And here you can see in this sort of schematic that there's a large amount of pus here behind the plug, which was probably right there. And then we've got a pustule or an inflammatory lesion of acne.
Now, why does this so commonly occur in teenagers? Is there something wrong with the teenage period in the sense that teenagers get acne, Dr. Lichtenstein?
Acne is a normal result of the change from being an adolescent to a teenager. And basically, the female and male hormones start flowing at around puberty, as manifest by beard growth and axillary hair and so forth. These same hormones cause the oil glands to secrete more oil, and because of the secretion of oil, acne has more of a tendency to occur in this age group.
Is there anything wrong with the hormone levels that these teenagers have?
These are absolutely normal, for the most part, hormone levels, and it's purely an end organ response. In other words, the oil gland is just responding to normal amounts of circulating hormones.
Is this just a period of adjustment in the sense of that the oil gland hasn't had the stimulation before?
That's pretty much right. The oil gland starts secreting the oil, and in some cases the oil gets retained, and subsequently acne develops. I might add that approximately 90% of the population has acne to one degree or another during their adolescent and teenage years.
Doesn't it seem to run into families, Dr. Jacoby?
It does, Ron, and I think if your parents, both of them had rather severe acne, you're much more liable to have acne of a more severe nature. And I think while we're on that, I think it's important to just think about the amount of acne that a teenager has is really not because he's doing something wrong. I think it's genetically predisposed how much acne you're going to have. And it's not that you're eating the wrong foods, you're not washing the face, and that sort of thing. So I think it is genetically predisposed to the amount that you're going to get. Everybody has it to some extent.
Okay, are there any racial groups or subgroups that seem to have more of a problem than others?
To my knowledge, it's a universal phenomenon in just about every society that's been looked at. It doesn't have any real racial predilection for one race.
I see, okay. Now, you mentioned hormones, Dr. Lichtenstein. There are some women that seems before their period or premenstrual, they seem to have a flare. Is this something wrong with their hormones again?
No, this is rather common, and the reason for it is approximately 4 days before a woman actually starts a period, the estrogen levels in her body decrease. And estrogens can actually help control acne in some form or another, and this is why certain birth control pills are used to control acne. Well, anyway, when these estrogen levels fall, the testosterone, which both men and women have to some degree, sort of takes over, and subsequently, around the time of their period, these women will flare.
The testosterone is a male hormone, but it's present in women as well?
True. The adrenal gland secretes some amount of testosterone, and this is probably the reason that many women do develop acne. And again, this is a normal phenomenon.
Now, what about the woman that didn't have this teenage acne or a problem, but it seems to have come on late in the 20s, Dr. Jacoby? Again, is there something wrong with this person?
Not generally. We get this question all the time. We have women in their 30s wondering if puberty is ever going to end. But as Dr. Lichtenstein pointed out, that most of the time acne is initiated at puberty because of the hormonal changes. And I like to think of most people having trouble with acne for about a 7 to 8 year period. And in women particularly, it seems that this may come later in life. We have a lot of women that go right through their teenage years with no trouble, but 25 to 32 they have trouble with acne, or rarely some 30 to 35. So I think everyone has an adjustment period to adult hormone levels, and we call that acne, and it may come just about at any segment in life, but generally, around puberty.
It is interesting that women tend to have a shorter duration of acne. Men very often will have acne from their early teens up into their late 30s pretty continually, and again based on genetics, as Dr. Jacoby mentioned before. Women tend to have a more finite length of time where their acne is really a problem.
So we really can reassure a lot of these women, Dr. Jacoby.
I think so. I think the other reason that women in general have less serious acne is because testosterone, the male hormone, is the main driving factor for acne. And of course, men have a large amount of that, and women just small amounts produced primarily by the adrenal or the ovary gland.
Well, I had to be off chocolate for 4 or 5 years, and I want to know, is diet important in acne, Dr. Lichtenstein?
Diet is important, but it is not important in the sense that you're bringing up. Basically, a good diet is important for all of us. However, the fried foods, the chocolates, the greasy foods that we used to talk about as being inciting factors for acne really do not play a significant role. I virtually have none of my patients on diets which are eliminating these things. There is an occasional patient who might say, every time I eat a chocolate bar, I break out. Well, I feel for those patients, if they feel that that's the case, then they should just avoid chocolate. But for the most part, the foods that we used to talk about as being a problem are not. There are, however, some things in the diet which may be a problem, primarily excessive amounts of iodine. And this is found primarily in vitamins containing minerals, in kelp and kelp tablets, and people who eat excessive amounts of seafood. I used to practice in Florida where people would eat seafood on a daily basis, and there that was a real problem. In Tucson, where we just can't afford to eat seafood every day, it's not that much of a problem.
Would you go along with that in general there's no scientific basis to really severely restrict certain foods?
Yeah, that disappoints a lot of mothers, but generally I tell them just to go easy on the junk food, and chances are it's not going to make much difference in their acne. Most of the patients that come to see us have already tried this, restricting all these things, and of course they haven't gotten any better, and that's why they're here to see us.
Okay, another critical question, cosmetics, Dr. Jacoby.
Well, for our women patients, there's no question that certain cosmetics can make your acne worse. In general, without going into a lot of brand names, and there are millions of brands out there, it's the oil-based heavy foundations, pancake-type makeup that can make your acne worse. And the other offender is night creams, oil of Olay, moisturizers, these heavy things that most young women aren't wearing unless their acne is so bad they're just trying to cover it up. And then that will lead to more blackheads and whiteheads down the road, and of course more acne. So we try to get them off those things.
Is water-based necessarily oil-free cosmetics, Dr. Lichtenstein?
Oil-free is oil-free. Water-based means that it's a water-based cosmetic, but it might have oil in it. And I have my patients do a little test on their makeup, and they just take a drop of their makeup that says water-based and put it in a glass of water. If you get an oil slick, that means that there's obviously oil in the makeup, and it should be avoided.
What about chemicals maybe at work or garments around the neck or on the back, Dr. Jacoby?
Well, there are some environmental factors that rarely make acne worse. In the workplace, I think the big one is chlorinated hydrocarbons. And these, cutting oils and these type things, if you're, they're not very prevalent, thank goodness, but they can cause a terrible type of acne called chloracne that is extremely scarring and very difficult to control. Garments, I think some athletic headgear makes acne worse. We all see our football players get worse during the season where the chin strap rubs and the leather rubs here. Friction definitely from rubbing things will make your acne worse.
I was quite depressed sometimes with my acne as a teenager, Dr. Lichtenstein. What role does emotion play in acne flare-ups?
Well, I believe that acne does flare with emotions, and this is evident on any college campus around the time of final exams, where if you look at the students, you'll invariably find more acne lesions on the average student than you would at a more mild time during the school year. So that emotions can play a role, and again, probably because of adrenal stimulation and more testosterone being on board.
Is there an acne personality? I want to ask you that.
Well, there may be an acne personality, but I don't think it's a cause and effect. In other words, I don't think that the personality causes the acne, but I feel that rather severe acne can cause a withdrawn, shy type of personality, the type of person that sort of sits like this and really doesn't look at you straight in the eye, and you know that they're somewhat embarrassed about their complexion. Again, there's no need for that, as we'll discuss later in the show.
Now, many of us are taking medications, and some of them probably have some effect on the acne, or seem to, Dr. Jacoby. Are there any general groups that are commonly causing this problem?
Well, in thinking about that, there are only a few medicines that can make your acne worse. Comes to mind first is lithium, and that's mainly used by the psychiatrists for severe depression. Iodides, as Paul mentioned, in large amounts from if you're on a seafood diet or kelp tablets, definitely, and likewise bromides can do that also. I think the biggest cause that we see for aggravating acne sometimes is a person that gets a hold of someone else's prescription of cortisone cream,
Which is a steroid?
which is a steroid, a cortisone cream for, usually it's given for inflamed skin, and starts using it on his face for acne. Now he discovers that it makes things better for a while, but the problem is eventually it becomes to cause even more acne, yet he continues to use it because as you put it on it makes the redness go away for a few hours, and then he thinks it's helping, but in the long run it's really making things worse. Paul, do you have any others you can think of?
Yes, there's one point that I do want to make, and that is that we're talking a lot about iodine and things of this nature, and people are concerned about iodized salt.
Right.
Well, first of all, one should not use a lot of salt in any event, and the amount of iodine found in iodized salt is such that it shouldn't really be a problem.
Yeah, that you don't have to worry about.
Now, most of us treat ourselves at home. We may use some over-the-counter agents.